Hi, my name is Pam Sagness, and I'm the Director of the Behavioral Health Division with the North Dakota Department of Human Services. And I was asked to be here today in order to give an update about North Dakota's behavioral health system reform and provide some information about the work that's being done in this state. I think that it's important to just really draw the connection between the supports and services that are available for behavioral health and the reason that we're all here today. So I wanted to provide an update about, first of all, making sure everybody understands what the word behavioral health means. I think historically we heard people say things like behavioral health and mental health, or behavioral health and addiction. But I think it's really important to note that today behavioral health is really an umbrella term that's used to mean overall wellness. So that includes prevention, it includes treatment, it includes things like depression, anxiety, and substance use disorders. And so when we talk about the word behavioral health, we really mean an emotional state of well-being. And so this is just some examples of what behavioral health is. As we continue, I think it's important to note that I'm going to talk a little bit about all realms from prevention to recovery, but also speaking specifically about individuals who have a substance use disorder or a mental illness. This is a document that you may have seen. This is North Dakota's data relating to substance use disorder and also any mental illness. And so what you can see is that 9.1% approximately of our population of North Dakota struggles with a substance use disorder. And 16.1% of our state also struggles with a mental illness. And so when we look specifically at any mental illness, that could be something like short-term depression, anxiety. It doesn't necessarily mean someone who has a chronic or long-term issue with a serious mental illness. But I do think it's important to note that there's a couple of reasons why looking at this data is so important. One of the things we can learn from this is, are we currently providing services to the majority of people who may need them? And I think right now we can say no. We know that in North Dakota we have a significant shortage of services and supports available, and that's in all areas of the state. Certainly there are differences between accessing services in our rural areas than our urban areas, but it is not, we certainly aren't meeting the need. I also wanted to note at the bottom the overlap between substance use disorder and mental illness. And I really think that this number is still underestimated, because people and in general our systems have really siloed substance abuse and mental health as two different things. And so we haven't had integrated systems, and we haven't looked across our systems in a different way. And so it's really important that we recognize the connection between substance use disorders and also mental health conditions. So I wanted to also pay attention to a couple of things that I think really speak to why this is so important. By 2020, mental and substance use disorders will surpass all physical disease as a major cause of disability worldwide. And yet our resources and our policy is certainly not comparable to what we see for physical health. Also, individuals who have a behavioral health disorder die on average about 5 years earlier than persons without this disorder. And someone with a serious mental illness are now dying 25 years earlier than the general population. So when we look at the disparity of the services and what we're doing in regard to behavioral health, I think it's really obvious that this is a place where we need to develop policy, we need to develop resources, and we really need to build a system. So I'm going to talk a little bit about that. There's been three key things that have been conversations over the last couple of years while we've been in behavioral health reform. One of those things is that we need community-based services. Historically, there's an idea that if someone has an addiction or a serious mental illness, that they need to go somewhere or be put somewhere. We need to find a bed. But those are short-term solutions for a chronic disease. And it's something that we really need to reframe the way we think about offering services. Right now, most people will be able to access some type of high-level service, whether that's inpatient or residential. But what happens when that service is done? Where do you go? What are the continuing services? Where's the community supports? What about natural supports? So those are some of the things that we really need to look at developing. And again, this is not just a rural issue. This is an entire North Dakota issue. Community-based services we don't have enough services to provide to meet the need. The second thing is to stop criminalizing behavioral health. In general, behavioral health in North Dakota has been significantly criminalized. In order to get treatment, you must go to jail. In order to get treatment, you must go to prison. The Justice Reinvestment Initiative that has happened over the last couple of years, one of the surveys done, actually surveyed judges. And 70% of North Dakota judges said they had sentenced someone to prison in order to get treatment. The door to treatment should not be a correctional facility. And so we need to change the way that we look at behavioral health services and access to services. Lastly, we need to support the full continuum of care. This is the continuum of care. This is from the Institute of Medicine. And it's important to note that if at any point in time in our state we're missing one of these services, we will overtreat, undertreat, not prevent, but we will not have what we need in order to support the citizens of the state. And so it's so important that we support this entire continuum. There's a couple of things on the bottom I wanted to note. In order for us to really have an effective system, we need to ensure that we have funding at all levels of the continuum. That means there must be reimbursement for early intervention services instead of waiting for a diagnosis so that then we can get services, which means we miss a window of opportunity between the first symptom and a diagnosis. It also means that we wait until someone is very sick in order to offer a service. It also means we need to consider our workforce. There are some barriers and things we should be considering, whether it's licensing or reciprocity issues, or looking at peer support as part of our workforce. And those are things that are underway right now. And lastly, that we're utilizing best practice. We can have all the services in the world, but if what we're doing isn't effective, it doesn't matter. So we have to ensure that the services we're providing, that they're actually best practice. One example of this would be with the opioid crisis. Just a year and a half ago, we got our first opioid treatment program in the state. Only a year and a half ago. And yet it's best practice. Those are the things we must consider. I also wanted to talk a little bit about just making sure that we look at return on investment. We know that we can invest in prevention and save $1 to $68, according to the Surgeon General's report from 2016. $1 for $68 if we invest in prevention. So this graph shows a little bit of that continuum looking at investment and also the number of individuals that will be served through those services. And then also to note the social determinants of health. One of the things that we're doing at the Department of Human Services is we are building our strategic initiatives and our plan around the social determinants of health. If I'm hungry, therapy doesn't matter. If I don't have a place to live, treatment doesn't matter. And it's so important that we start recognizing homelessness and education and community and social supports and all of the things that are social determinants of health to be relevant to behavioral health. And if there's one thing that I want everyone to hear today, behavioral health is health. And so it's important that we start to recognize and hold behavioral health on an equal footing with physical health. There are some reforms going on. I just wanted you to note that on our website, which I'll give on the last slide, this is a behavioral health assessment that was published just last year. It talks about the gaps in our system and really builds a blueprint for how we are transforming our behavioral health system in this state. Looking at specifically, we have significant gaps in our children's behavioral health system and really needing to focus on what we need to do to transform that system. I also wanted to let everyone know that we have a North Dakota Behavioral Health Systems analysis that's occurring right now. We should be getting results in February. This is where they're actually taking not just feedback from stakeholders, but data from Medicaid and the Human Service Centers and the state hospital and analyzing that data so that we can actually get to a point of action. Right now, it's been difficult to develop fiscal notes when we don't have numbers. We have a lot of ideas and a lot of thoughts, but not necessarily what we need in order to move ahead. So that should be published and released in February. And we will be putting it on our website for individuals to review and provide feedback before there's a final product even. I also wanted to just note that we have contracted with the Center for Rural Health to do a workforce development plan for the state, recognizing that workforce is one of the significant issues to developing our behavioral health system. One of the first things we're doing is building off the strategic report that will be coming out in February, but also building peer support certification. And so individuals will be able to have lived experience and support one another in a way that hasn't necessarily been supported in the state at the level that it should, as really a professional service. And then also to note that the Free Through Recovery program, which is part of Justice Reinvestment, This program is launching February 1st, and there's more information on our website. There's a 4-minute video that does a nice overview of what the program is, and I just encourage you to go to our website. Here's our website. All of the resources are available here, connections. We have searchable data. We have prevention and connection to resource and treatment. So if there's any questions, please go to that website or send us an email. Again, my name is Pam Sagness, and I'm with the Behavioral Health Division. Thank you.